So in this video, we're going to talk about the shoulder and the arm. The rotator cuff is made up of four muscles: your supraspinatus, infraspinatus, teres minor, and subscapularis. Out of those four, the supraspinatus is the one that's most commonly injured. You can get rotator cuff tendinitis or impingement syndrome, and this will present with lateral shoulder pain that's worse with abduction and external rotation of the arm. Also, they'll have a painful arc test, meaning when their arms are extended out to 60 degrees or 120, they're going to have a lot of shoulder pain. Next, you have adhesive capsulitis, which is also known as frozen shoulder. This happens more commonly in older people, and that's when there's a contracture of the joint capsule. So they're going to have decreased passive and active range of motion. To help treat them, you just have to get them to move their shoulder more, so physical therapy exercises is the way to go. We have biceps tendinopathy and rupture, which will present with anterior shoulder pain, which is different than the lateral pain with rotator cuff injuries. Biceps rupture will present with pain while lifting or carrying things or with overhead reaching motions. Next, there's a couple nerves that you should know about in the arm, and the mnemonic is ARM, A-R-M, so axillary, radial, and then musculocutaneous. The axillary nerve innervates the deltoid and teres minor muscles, which also help with shoulder abduction. If you ever have a mid-shaft fracture of the humerus, that'll affect the radial nerve, which innervates or gives sensation to the back of your arm and hand. And then lastly, you have your musculocutaneous nerve, which innervates your biceps brachii and brachialis muscles and also provides sensation to the lateral part of your arm. Next, we have our long thoracic nerve, which innervates the serratus anterior muscle, and if this is damaged, you'll get a winged scapula. Now, for the brachial plexus, for step 2 and step 3, they don't test it in as much detail as they do on step 1, but you should know the top and the bottom of the brachial plexus. So at the top, we have C5 and C6, and if that's damaged, you'll have the Duchenne palsy or the waiter tip hand, and then in babies, they'll have an absent or decreased motor reflex. Bottom part of the brachial plexus is C8 and T1. If that is damaged, you'll have a hand paralysis known as Klumpke palsy, and you can also get ipsilateral Horner syndrome. Also, if you have a Pancoast tumor, which is like the superior sulcus of the lung here, that can also cause like a C8-T1 palsy. Next, we have Olecranon Bursitis, which is a swelling on the back posterior of your elbow. This will be fluctuant on palpation. You just get it from an overuse or minor trauma. Treatment for that is just rest, ice, and NSAIDs. Lateral epicondylitis is known as tennis elbow, which is caused by repetitive motion of wrist extension. And then medial epicondylitis is the golfer's elbow, which is from wrist flexion. And you'll have tenderness on the respective sides. Lastly, for dislocations of the shoulder, posterior dislocation is most commonly caused by seizures, and then anterior shoulder dislocation is the most common type of dislocation. An anterior dislocation will present with an abducted and externally rotated arm, and a posterior dislocation will present with an adducted and internally rotated arm.